As the country mourns the death of popular musician Mampintsha, another artist, Thokozani Ndlovu, popularly known as L'vovo Derrango, is in hospital after suffering a minor stroke. Mampintsha also suffered a stroke before he passed away over the weekend. Now, according to the Heart and Stroke Foundation, an average of 10 adults suffer from a stroke every hour. For more on this, we are joined by Professor Nqoba Tsabedze, who is also an academic head of cardiology at the University of Wits. Thank you so much for joining us this morning, Prof. Now, 1 in 4 adults will, over their lifetime, experience a stroke. Are we seeing a prevalence more among men or women when it comes to strokes?
All right. Thank you for having me onto your show, and good morning to your listeners. Indeed, non-communicable diseases driven by atherosclerotic cardiovascular disease, which stroke falls part of that, is an emerging pandemic which we are under-recognizing and giving the attention it deserves. And a stroke, especially in individuals of African origin, driven by a high prevalence of hypertension when you have a high blood pressure, is very, very common and prevalent. And the beauty of stroke is that it's easy to diagnose. Once individuals have complicated stroke, there's no question that there's a neurological fallout and the individual usually gets paralyzed one side. And so we definitely see an increased incidence of stroke in our population. Traditionally, women are protected in their premenopausal years by their estrogen levels that have a lot of metabolic benefits, and men tend to have a higher risk than women pre-menopause. As soon as women reach menopause, however, they have the same risk as men, and we see similar incidences of cardiovascular disease, of which stroke is one of the manifestations of that.
Now, Prof, we also quite often associate strokes with the older generation. But as I mentioned earlier, the 2 South African musicians, they are in their 40s. So should young people be just as cautious when it comes to the prevalence of strokes?
Yes. In fact, as I said, we are in the middle of a pandemic. Just to rattle some numbers, just to give you perspective, we've had 2 years of COVID-19 since early 2020. I think to date, we're sitting at approximately 7 million global deaths from COVID-19. Atherosclerotic cardiovascular disease, stroke, and ischemic heart disease being the drivers, annually takes about 18 million people in terms of global mortality. And that number is an estimate from 2018, 2019. So now in 2022, as we merge into 2023, definitely that number is increased. We're seeing these conditions in a lot of young people. Hypertension, as I said, is the prime risk factor that we have as a very common risk factor that's poorly controlled, poorly diagnosed, as well as poorly managed in our community. And we're seeing strokes even in 30-year-olds. So I'm not alarmed or shocked by these incidences in these 2 40-year-olds. Of course, what's unique is that these are well-known, popular individuals, but day to day, we battle with this pandemic and individuals with these conditions which we could control and prevent presenting with stroke, which is life-changing and ultimately leads to mortality when not diagnosed and acted on early.
Prof, I mean, these numbers that you're citing are quite alarming and really would push us to believe that this is a pandemic. Do you think that there's enough awareness and knowledge around the world when it comes to strokes? Because when we think pandemics and when we think of diseases that are likely to wipe out our population as HIV and AIDS, it's cancers, but we don't often really speak about strokes and heart disease in a way that we should be in terms of creating awareness and for people to be alarmed.
Definitely. I think the problem with cardiovascular disease is that it's asymptomatic until that fateful morning or night when you either have a stroke or a heart attack. Many of us don't check our blood pressures. We are not in pain. We're not coughing. And sometimes even clinicians, doctors, physicians, nurses, when they do screen patients for other ailments, they may identify an elevated blood pressure and not act on it. But also because patients are asymptomatic, when you start suggesting therapy at that stage, they may have a low threshold to be compliant or an interest to get onto therapy. And so we have this challenge of first of all, acknowledging that this is a killer. It's a silent killer. That's the name that usually goes around in circles. And yet we struggle for individuals to be diagnosed. So definitely awareness is a big problem. We probably are in denial. The other element is that because it's a non-communicable disease, it generally doesn't have a lot of international attraction, whereas conditions like TB, multi-drug resistant TB, HIV and AIDS, Ebola, COVID-19, there's a lot of international concern that those diseases can spread globally and reach other areas. So there's always, anthropological individuals who are willing to support missions to contain those diseases. With non-communicable diseases, unfortunately, it's something that we have to drive ourselves, because when you have it, it's you. You can't give it to the next person. It's usually a result of poor lifestyle, poor identification of the typical risk factors, such as hypertension, smoking, living a sedentary lifestyle, a high intake of salt, diet, dyslipidemia, just to name a few. And in fact, cancers also fall part of non-communicable diseases. And looking at the proportion of stroke, heart diseases, these are far more prevalent than cancers. But what happens with cancers, because the individual usually wastes before us, it's very graphic, it's a very heart-moving situation, and hence an increased awareness. In fact, if you're diagnosed with cancer, you are more alarmed about it and you want to take action. Everyone is concerned. It means you're on a death journey. Whereas if someone says to you, you have hypertension, or you have dyslipidemia, or you are a smoker, generally those are benign. We don't get stressed or alarmed by them. It's like, oh, I'll live with it. And only to find, later on at some point you'll succumb to either a stroke or a heart attack.
Right. So, Prof, when they speak of early detection, that it assists in the recovery process, what should one be looking out for in terms of seeing that one is about to have a stroke? And once that stroke has happened, what do you need to do thereafter?
Okay. So stroke, basically, just to define it, what really happens is when you have these typical risk factors that you have, which I've mentioned, such as hypertension, smoking, high cholesterol, there's a build-up of what we call as atherosclerosis, or should I call it dirt in the blood vessels. Now, the blood vessels are the network that basically keeps all our organs in the body alive. Now, depending on where that dirt has accumulated significantly, if it's the blood vessels in the brain and leading to an acute occlusion of one of those major blood vessels, you then present with a stroke. And if the same thing happens to the heart, you simply present with a heart attack. So it's the same disease process, but depending which organ is now manifesting, we're either going to call it a stroke or we're going to have a heart attack. But for our discussion today, let's focus on stroke. So typically what happens with a stroke, an individual would complain of being paralyzed on one side, and usually, because generally it's one vessel on one side of the brain. The brain has two hemispheres, and when one of those vessels gets occluded, the individual presents with paralysis of the one side. If that individual presents to hospital timeously, we can give them certain therapy that can try to restore blood flow in that acutely occluded vessel. But many times when this happens, individuals are not aware that I'm actually having a stroke. And so they sit it out at home, they try other concoctions, medications, etc., only to present late. And by that time, the medical team can't do much. There's the injury to the brain tissue, which is nervous tissue, is already well established and complete, and there's no potential reversibility. So the first thing is when you identify yourself to be having some form of paralysis, slurred speech, you can't talk well, sometimes your vision may also be impaired on the one side, get to hospital urgently. That's what I would recommend. And in the hospital, the medical team needs to expedite timing when did this event start, and then instituting this therapy which may recanalize or reperfuse that blocked artery so that we can save as much brain tissue to alleviate any chronic disability.
Lastly, Prof, is there an average lifespan after one has suffered from a stroke?
Not really. In fact, many individuals who have been identified and treated who are living with paralysis, for example, They undergo physiotherapy, occupational therapy. They take therapy to control the risk factors, and they can actually lead a meaningful life. A lot of the residual function can be regained, especially if individuals have had stroke at a young age, because the brain does have the ability to make new connections so that you can relearn certain activities which you would have lost during the time of the acute stroke. So there isn't to say, oh, you have a short lifespan, for example. However, the complications, especially when not managed, if you are having difficulty mobilizing, you're getting pressure sores, you can't speak well, you can't indicate when you're thirsty, you need to be rehydrated, or you can't clear your airway in terms of you choking or something, you want to cough. Usually those are the complications that ultimately kill individuals who have succumbed from stroke. So it's not that they usually have a repeat stroke and that now they die from the stroke itself. They usually succumb from the complications because now they are either wheelchair bound, have limited mobility, have reduced reflexes to clear their airways, have limited ability to complain about issues such as bed sores, etc., thirst, and ultimately those complications are then what lead to their untimely demise. But when managed appropriately with adequate rehabilitation, one can still lead a meaningful life and contribute to society.
All right. Thank you for your time this morning, Professor. We really do appreciate it. That was Professor Nqoba Tsabedze speaking to us there about strokes and ensuring that we lead healthy lives, cut down on the alcohol and the smoking, and also make sure that you live a healthy life for you to avert a stroke. Now,